Mom is on hospice for end-stage dementia. She oftentimes experiences aggression, combativeness, personality changes, and strange behaviors, and it's really hard to manage. What can I do? There are three different things that I think about here. Number one, when a person has end-stage dementia, they have lost the ability to communicate. So they've lost the ability to understand that receptive communication. They don't know what you're saying or what you're trying to tell them. And they've lost the ability to verbally communicate what they are trying to express. And so these behaviors are really a form of communication. The second thing is that with end-stage dementia, there are issues with communication within the brain. So we have this part of our brain called the amygdala. It's what turns on that fight or flight response. So let's say, for example, that someone gets up in your face and starts yelling at you, your amygdala is going to be screaming fight or flight response, that fear response. And your automatic response might be, I'm going to punch them in the face because I'm scared. We have something called our prefrontal cortex, which is responsible for making thoughtful decisions. And that prefrontal cortex might say, well, that's probably not the best idea to do right now. In someone with dementia, that prefrontal cortex isn't working. And so that person might punch you in the face, but it's really out of that fear response. The third thing to think about here is some people with dementia actually have a higher likelihood of experiencing things like psychosis, aggression, combativeness, personality changes, and this simply has to do with the disease progression, the impact that that disease is having on the brain and changes within the brain. So when we respond to someone who is experiencing this sort of combativeness or aggression, it can be helpful to have all of these three things in the back of your brain. Might it be that they have some unmet need? They're hot, they're cold, they're hungry, they're thirsty. Might it be that you've really triggered this fear response in them? Or might this be their disease progression? In our response, we want to remain calm. We can show them what we want them to do before actually touching them or approaching them, letting them know that they are safe, getting on their level, maybe reflecting back what you're seeing, showing them that you're actually on the same level. Sometimes just taking a step away, giving you some time to breathe, giving them some time to breathe, and then coming back to try again, and always approaching from the front so they can see you. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education. If you're interested in learning more about how to support people at the end of life, you can learn more at our free training at deathcarecoach.com.